हाय एवरीवन, सो लेट्स लर्न कि कोई भी बैड न्यूज़ कैसे ब्रेक करते हैं टू द पेशेंट और टू द अटेंडेंट्स।
अब इस चीज़ को ऐसे समझो कि वाई वी आर ट्राइंग टू अंडरस्टैंड द एथिक्स एटीट्यूड एंड कम्युनिकेशन बिकॉज आफ्टर यू बिकम अ डॉक्टर यू विल हैव टू डील विद द पेशेंट्स एंड देयर emotions do come along because we are not robots, we are not working through the AI technology or something like that. So you will definitely have the emotions from your end and from the patient's end, right? And their relatives are also involved, so you need to be very very patient and calm towards the patient and their problems so that you are able to communicate in a very healthy way, right? And for this we also need to know how to break a bad news because not every prognosis will be good. So some of your patients will have poor prognosis and you need to channelize it through properly to the patient and to their relatives so that they are well prepared and well oriented towards the disease progression, right? So that is the reason why we were trying to focus upon empathy, sympathy like things, so that these skills you develop over the years through your regular communication, and by the time when you are able to reach to the clinicals or at the site of the patient, then you are able to communicate better to the patient, right? So our aim is to use these skills to deliver these news clearly, honestly and sensitively. So your news should be clear to the person, it should be very very honest, and you should also have that sensitive touch towards the patient so that the patient feel understood and supportive. Now the spikes protocol is a 6-part method. तो ये एक 6-part method है, इसके 4 main objectives हैं. What are the objectives? You have to share the information with the patient, gather the responses from them, what they are feeling, provide a vital support to them, and create a plan to move forward. So how all things will be doing. कोई ऑपरेशन अपकमिंग आप लाइंड अप कर रहे हैं, कोई कीमोथेरेपी रेडियोथेरेपी होने वाली है पेशेंट की, अकॉर्डिंग टू द सिचुएशन ऑफ द पेशेंट कितने दिनों का स्टे उसका हॉस्पिटल में होने वाला है, कितना लॉन्ग टर्म मेडिकेशन पे रहेगा, हाउ मेनी फॉलोअप्स आर देयर. So all these are long term plans which you need to discuss with the family as well as with the patient, right? So what do you mean by spike? So S for spike में S का क्या मतलब है? S means setting. तो setting का क्या मतलब है? You have to set up a meeting with them. तो ऐसा ज़रूरी नहीं है कि you have to be like कि कभी भी आप मीटिंग कर लीजिए. यू हैव टू चैनलाइज द टाइम विच इज़ सूटेबल टू यू एंड योर पेशेंट्स एंड योर अटेंडेंट्स, ताकि आप एक वेलकमिंग रिस्पॉन्स दे सकें, ना कि बहुत ही कोल्ड और बहुत ही रिजिड रिस्पॉन्स होना चाहिए कि लाइक आई हैव टू ब्रेक द न्यूज़, सो आई एम ब्रेकिंग द न्यूज़ नाउ एंड हियर. You have to see the situation where you need to break the news. You don't have to drop a bomb, right? तो आपको एक रैपिड पहले बिल्ड करनी पड़ेगी, कनेक्ट बनाना पड़ेगा, and you have to look up to the patient, and then you have to show the empathy and the emotional connection, and then you need to break the news to them, right? Then P is for perception. Perception means you have to understand the patient's current level of understanding. उसका कितना नॉलेज है, वो मेडिकल टर्म्स को, मेडिकल इश्यूज़ को कितने अच्छे से समझ पा रहा है, जो आप उसे समझाना चाह रहे हैं उसकी कितनी रिकवरी हो पाएगी, क्या प्रोग्नोसिस हो पाएगा, क्या वो उस बात को समझ पा रहा है या नहीं समझ पा रहा. एंड यू हैव टू कम टू देयर लेवल ऑफ अंडरस्टैंडिंग और टू मेक देम नॉलेजेबल अबाउट द डिजीज़ दे आर सफरिंग फ्रॉम. So it is very very important when you make a meetup plan or when you do a gathering with them, you need to be more vigilant and more need to be very much aware of your patient's understanding, and you try to listen more rather than talking at that particular stage. Then third becomes, in the spike becomes invitation. Invitation is ask your patient about the details or the treatment they might face, right? So meet your patient जहाँ पे भी वो मिलना चाह रहे हैं. हमेशा उन्हें force नहीं करना that you need to meet now, here and there only. Means the patient has all the right that whether they are ready for whatever information you are trying to give or they are not ready. It might be possible that the patient is not mentally ready to know all the details what you are trying to give to the patient, or is not able to hear emotionally about all the upcoming things in his life. So you need to give time so that the state of the mind of the patient is stable and is able to understand your thing. Then comes the knowledge part. In the knowledge part, you have to share the knowledge with your patient, whatever information and knowledge which is related to that particular case, and whatever prognosis is there, you have to tell the patient and make them understand how the things are going to happen in the long term, right? So you directly need not rush to the protocol, but you rather need to make them understand what you're trying to explain them, what all procedures will be happening, what all follow-ups they need to attend, and we need to speak more in the plain or the normal language rather than using the medical terms, right? Then E part comes. E part is the emotion. You have to be very much emotional and expressive about your emotions, so that is the reason why we were trying to explain you what is empathy and why you need to be compassionate towards your patient. So instead of giving reactions, you need to be very, very calm and understand their level of pain and sadness. It is also possible after coming through, if there is a bad prognosis, the patient or the relatives may go into the sadness, denial, or shock or something. So you need to be mentally prepared for all the situations coming ahead to you as a doctor, right? And finally, you come over with the S spikes. Last wala S is strategy and summary. Ending the meeting with an intention ki what we will be going to do next, and when is the next meeting we are supposed to meet, or what is the next appointment, what all things we'll be doing, we'll be changing the medication, we'll be continuing, what all therapies are pending, any counseling sessions to be given to the patients or the attendants, whatever is there, you have to channelize according to the level of the patient. So this is the way how you break the bad news to the patients or the relatives in the spike protocol. So yeah, thank you so much. This is all for today. Like, share and subscribe to my channel. Thank you so much. Bye bye. Tata.